Hey guys, welcome back to Buying the Pharm. And what we're going to be covering today is going to be aspirin. As always, I'm going to talk a little bit about the drug itself, and then I'm going to go into the SoCal EMS testing portion of the presentation. So aspirin itself is a salicylate, and it's used for patients of chest pain or of suspected acute coronary syndrome. Oftentimes, it's believed that aspirin is a blood thinner, and traditionally, it's not a blood thinner, it's a platelet aggregate inhibitor, meaning that it decreases the likelihood for platelets to stick together. This is an analogy that I like to use. So imagine that when we go hiking, we have those little stickies in our socks, and those stickies, they're round and pointy and pokey, and they stick to our socks and they stick together. Imagine if those are your platelets. So when we take aspirin, instead of those stickies being pointy and able to stick together and stick to your socks, imagine if we made them smooth and the likelihood of them sticking together or sticking to you decreases. So aspirin doesn't thin your blood, but it is a platelet aggregate inhibitor, or it inhibits the ability for platelets to stick together. Therefore, it's decreasing the potential for the clot to become bigger in your coronary arteries. Your general dosage for aspirin is going to be anywhere between 160 and 325 milligrams. Most baby aspirin tablets are 81 milligrams. So we will give our patients 4 81 milligram tablets for 324 milligrams. We have enteric and non-enteric coated aspirin. We try to give non-enteric coated aspirin, which means as our patient chews these up and swallows them, they're going to absorb into the stomach a little bit more readily, and it's going to get into the system sooner than later. What an enteric coated aspirin is just a coating over the aspirin tablet that doesn't get absorbed into the stomach and gets through the stomach into the small intestines, or it's absorbed there. We need to be careful with patients with ulcers or GI bleeds, because it's going to decrease our body's ability for those platelets to stick together. So if we have a GI bleed, we want to make sure that we're aware of that. Now we're going to go into the testing portion of the video. This is the verbatim test that you will see for your test here at SoCal EMS. So we have aspirin, ASA, class, salicylate, dose 160 to 325 milligrams, route orally, PO, onset 15 to 30 minutes, duration days. Action inhibits the normal tendency for platelets to accumulate inside injured or occluded cardiac arteries, thereby promoting better blood flow through vessels to better perfuse the heart. Platelet aggregate inhibitor. Indications: chest pain or discomfort of suspected acute coronary syndrome. Medical direction approval. Contraindications: administer with caution to patients with history of bleeding ulcers / GI bleeds, upper and or lower. All right, you guys, thanks for tuning in to Buying the Pharm, and we'll see you next time.